Welcome to Sterling Visionary Voices, the podcast dedicated to bringing you diverse, innovative leadership insights and actionable strategies for success. Join hosts Laura McNeil and Bob Medeiros as they explore the art and science of role model leadership through thought-provoking conversations with real professionals. Whether you're a seasoned leader or aspiring to excellence, Sterling Visionary Voices is your guide to navigating the complexities of your leadership journey.
Effective communication is the cornerstone for creating lasting and meaningful relationships. It can make or break a situation, especially when there is criticality associated with timely and accurate receipt of the message. With us today is Victoria Dune-Chari, Assistant Vice President of Quality Operations and Performance Excellence at Wellstar Health System, serving the state of Georgia and beyond. Victoria is a Baldrige Fellow and a Baldrige and Sterling Master Examiner, as well as a seasoned expert on the implementation of effective leadership systems. Welcome to Visionary Voices, Victoria. I'd like to start out with a personal question, if you don't mind. Could you clarify why this topic of communication is so very interesting and personally important to you?
First of all, Laura, thank you for having me. As we've talked about, I am honored, and I have been listening to your podcast, and I'm just awed that you would ask me after the lineup that you've had. So thank you, and I hope I have some good things to add to all the voices that have been on this show. But this topic is important to me because, as I have grown as a leader and as I've been working with different teams, when you work with Baldrige, you're working with teams across the country, where I've had the opportunity to lead, to have a roll up of up to 1,500 people at some point, and then I've had teams of one. And then the most important thing in team dynamics from the leader's perspective is to be able to communicate. And communicating starts with your personal why. I don't think anybody will work for you, follow you, do anything for you until they understand why you care. And I grew up, in a culture where you were humble. You didn't say who you were. You kept work very separate from your personal life. You didn't intertwine those things. And it was actually a leadership fellowship that I did when I was much younger for women of color that taught me that. The leader, the person who was leading it said, women of color, we're taught that, you just keep it to yourself. You keep going. You never let the side down. You just keep going. But as I grew in leadership, I began to understand that actually made me appear cold, not empathetic. And the more I communicated my personal why with people, the more different people, unexpected people were all across the creeds, across everything, were able to connect with me. So one of my personal whys, goes back to my mom, who I love very dearly. She died when she at a young age, 57, and she had end-stage renal disease. And there are so many times when I have told the story of my mom, the story of her passing, connecting that why things are important to me, where inevitably somebody from an audience, somebody on my team, somebody who I just tell the story of, this is my personal why, this is why what I do is important. It's important for us to get things right because it affects people. And I intertwine the story of my mom, and people will come to me and said, my husband has dialysis 3 times a week. I had no idea that we had that in common. Or they'll say, hey, my mom passed away, and I like you. And let me just share this a little bit of my mom's story is, I was living in the United States. My mother was living in Zimbabwe. I came here when I was 17 for college. And my mom, when she had end-stage renal disease and when she died, I had little kids, and so I had to go to Zimbabwe for 3 weeks to bury her, do all that, and then come on back. So when I came back, I had this phenomena where I was looking for her. So she used to call me every single day. Every day she would call me, and it didn't matter if I was in a meeting. In fact, if I was in a meeting, she would say something like, I would say, Mom, I can't talk to you. I'm in a meeting. But she would have been talking to me in Shona, which is like a dialect of Swahili. That's my mother tongue. And she'd switch to English as if, that made a difference. Like she'd go, "Oh, I was calling about my glasses." I'm like, "We're still talking, so you didn't, you didn't change anything here." But she called me all the time, and when she died, I kept on looking for her to call. So, that's like, this not a crazy woman, but I was like looking for her. Then I was looking for her. So I talked to some friends, and somebody, I think it actually was my like pastor, it was a spiritual leader, said to me, I think that your problem is you went, you buried your mom, and you came back, and you don't have like a grave to go to. You don't have a place to go finish, or continue with your grief process. You just came back, and it's almost like you were placed in a vacuum where this didn't happen. The last time you were here, this hadn't happened. So she said, people find different ways to honor that. So why don't you find something that would honor your mom? And I went through, like, so when I moved to the United States in the 1990s, in the mid 1990s, we used to write each other mail. So I had letters from my mom, and I had cards, and I was going through this box of mail from my mom, and I came across a card that she gave me when I got confirmed. And she had written, "This little light of mine, I'm going to let it shine." And then she had that verse, "Let your light shine for the world to see." And I didn't think anything of it. It was like a Sunday afternoon. And the next day, I had this big conference that I was going to with my boss. And it was on the Boston Harbor, and it was beautiful. So I went to this conference. I saw my boss. It was actually my first interaction with her since this had all happened. And my boss said, "How are you holding up?" And I said, "Oh, not letting the side down. I'm good." I don't cry. I've been looking for my mom. That's weird, but but I'm good. And we sat down, and the first speaker was introduced, and we were like front row, and the speaker was introduced, and the speaker came from like behind, and she started singing "This Little Light of Mine." And I started crying. And I had this cathartic moment in the most professional setting that you don't want to have a cathartic moment like that. And I had good goosebumps. I knew that, oh my goodness, my mom was with me. She's gone, but she's with me. It's like the moment that I knew. And from that moment on, that song became synonymous with me finding my mom after that. And that's a very uncharacteristic, if you know me, story for me to share. But that story of my personal why has connected me to so many people across the board who say, "Oh my goodness, I can relate to that. Oh my goodness, I saw a butterfly." And not only that, it's connected me to people who say, "My goodness, your mother died at 57." And I say, "Yeah, I work in healthcare quality operations. I work in performance excellence. It's important to me that we don't lose people when we shouldn't earlier. If we can do anything to prevent that, it connects me to my mom, because that was, if it happened to my mom, it can happen to anybody. And if we can prevent it, let's prevent it. So that's just an example of why I think that communication really starts with what's important to you, what leads people. It doesn't really start with, the nitty gritty, the objective. It's really about what's your true north as a leader. And if you can't connect with people on your true north, you really can. You may have people who are obligated to follow you because you do their reviews, but you'll never really influence people and have people who follow you because they want you, or they believe in your true north, or your true norths align, so you can have like a vision of what better could be.
So, this situation with your mother, that's your personal why. Is that what drove you to pick the career that you chose?
Yeah, my career trajectory has been so interesting. I started off in like medical imaging. And I was tech, and then, but I was tapped for leadership at a very young age. I mean, I was 23 leading seasoned nurse leaders, like that. I always look back and I say, what were they thinking? But what usually drove me to be tapped was, my drive for let's get it right. Let's get it right the first time. It's never a wrong time to do it's never the wrong time to do the right thing. It was what drove me within any role that I have. And then when I came to Wellstar, I was a medical imaging leader. It it's what drove me to be tapped to lead our performance excellence journey while I was a medical imaging leader and an operator in a hospital. And then I excelled at that because I had such a passion for it, and then now that's what I get to do every day that I wake up. It's another way of just saying, if you pursue what's what drives you, from Jerry Maguire, it's Monday morning, I wake up and say, let's go. you know, you will really be, you will do well, and you will have people follow you. And what I'll add, Laura, which is interesting for me, is in the last couple of years, I haven't really had like huge teams. I've had large teams before, but I've worked with, when you work in a system, in a healthcare system with multiple leaders, you are actually leading a lot of people by influence. They're not your direct report. Sometimes they're not even matrix to you, but you share these big goal items that you have to get there. So I think that kind of leadership is in a way where communication is even more important, because sometimes when people are they follow you because you're their direct leader, you affect their pay, you affect their review. They're following you because the system, the structure has made you. We're in a more ambiguous position where you all need to meet a goal, but people are not necessarily tied to you. Your goals may be tied together. It's a different kind of leadership. And I think in those circumstances, it's important to establish relationships and to have aligned visions. And one thing that I do, which I talk to one of our facilities is all the way in Augusta, which is a 2.5 hour drive for me. And I lead an initiative with one of our chief nurse officers, and she lives, in the opposite direction, almost opposite direction from me at 2 hours. And her and I have met in the middle and driven to Augusta together. And the reason we did that was I knew it was important for us to have a relationship so that we could be able to move this metric, move this initiative that we're on. And so driving those, it ends up being 5 hours, 2.5 hours back, two enough to to get to my car and whatever. She's always so willing to drive, and I would just sit there and chat. But it's made us know each other. It's made us communicate, understand our personal whys. We both have boys, so we can speak about our boys and see what's important to us, and then be able to say, and this is why we have to get this right for these communities that we serve. So I do think it's really important to invest in the relationship, invest in communicating who you are, to the extent that it allows people in to understand you and be able to follow.
I love that, leading through influence. How do you
Mhm.
think that leading through influence has helped you also connect with your customers and the patients you serve?
Because we're talking about communication, especially in the realm of medicine, but I think this crosses all customer sectors. Being able to be understood and to be heard and to be able to hear is one of the most important thing that drives the patient or the customer experience. Now, the unique thing about this, well, it's not unique. I think the great thing about it is everybody, no matter where you are, you have been a customer. You know what it is to have good service. You know what it is to be heard. You know what it is to have exceptional service. And most importantly, everybody knows what it is to have bad service. Even if it's just your internet service that's not reliable, everybody knows what it is to have bad service, right? So I think the customer experience is another place where it's really important for organizations, for leaders to invest in communication and communication plans that look at different things. And in the Baldrige world, we have organizations that have just done phenomenal jobs at this. I think of South Central Foundation. They're a two-time Baldrige winner. They're in Alaska. They serve a very unique community. They say, and in that they serve in that Nuka Foundation, the community they serve. That community believes in the power of storytelling. So, as a Baldrige Fellow, I had the privilege to visit them, and we first spent our first like 3 hours on our day on storytelling because that's important to them. They It is so important to them that they have built their some of their their in their learning center. They have built the rooms in such a way that you sit in a concentric circle with a place in the middle for the storyteller. So it's geared towards storytelling. And that aligns with the community that they serve because that's important to the community that they serve. And they actually have classes that they teach on how to tell story, on why story is important, because that's what connects them to the people that they serve and enables them to do well for those communities. So I think with customers, it's even more important. It's important when in healthcare. You would think that's the easiest thing, but sometimes we look at those metrics: communication with physicians, communication with nurses. Think about just the simple things that we have over the years matured in as healthcare systems. We put in a chair for a physician to come in and sit down so that they're at the same level as the patient and then they're not looking down at them, right? When shifts are changing, we don't want the nurses to talk about you without you. So we ask them to go into the room, surround you at your bed, and the one nurse giving over to the next nurse tells them about you while you're hearing about it, so that you have a chance to participate in that conversation and add value. That's maturity that has come along in healthcare. I remember when I was a child and I broke my arm, and every morning when people did rounds, it felt to me as a 7-year old like 10,000 white coats looking over me and talking about things I didn't understand. And all I cared about is, when was I going to go home? And am I going to have ice cream today? Like, and to go from that to what we strive for. And even then, we still don't get it right all the time. How many times have you been in a setting where people use acronyms? And we do this in medicine all the time. We start using acronyms you don't understand. I think it's powerful when people tell these healthcare stories. And I have a gynecologist who's done a great job. She, and I grew up in medicine. I grew up in healthcare, so you would think that I understand. But when something's happening to you, there's something that turns off. You become a patient, And I had to say one day to her, I said, okay, tell it to me like I'm a fifth grader. And she said, I'm going to draw you a picture. And she drew me a picture and she said, these are the problems. This is what we're going to do. We're going to go get these things out. And I am an imaging specialist and I needed that level of come down to me as a sick patient right now, even though if you talk to me in imaging, I probably could understand. But it was just that power of being able to tell the story in every circumstance. And the good thing is, anybody can do it, because when somebody doesn't feel heard, it doesn't matter what's the circumstance. You just have to relate to a time when you didn't feel heard, you know, and say, listen, I understand. I hear you. Say things that enable the customer to be brought in. And my experience, and when I talk about patient experience, I've had the opportunity to lead it at our largest facility, to lead it for multiple outpatient departments at the same time. It's really those simple things, systematic processes that allow you to, that intentionally force team members to listen to the patient and acknowledge, we say things like AIDET, you know, little things that are systematic processes to help you do the things that we're just telling. Tell your story, understand, introduce yourself, acknowledge why they are here, tell them what you're about to do to them, and this is the art of storytelling systemized so that we can hear and communicate to patients, because at the end of the day, to patients, to customers, whoever, at the end of the day, if they're not satisfied, we're not running a business.
Just to clarify, for those who may not be familiar with the acronym AIDET, AIDET, it stands for Acknowledge, Introduce, Escort, Explain, and Thank. It's a customer communication method that has been supported by the Studer Group for Healthcare, as well as Huron Consulting. But Victoria, I do want to say that you're raising some really good points, because when I look back at the leaders that have really stood out in my memory as role model, they are the ones that have shared their personal why. They are the ones who have reached out to me and shown that they care and that I matter as a person. And those are the leaders that I remember and I recall.
There's so many things that have been written about leaders. one of the people who really influenced me earlier on, and he's a light writer on legacy leadership, and I think we'll get to legacy leadership in this, but he talked about, what do you want to do? So he has this story that he tells about, you have your team, and there's a forest, and you're supposed to get to the other side of the forest. And as you get there, it's dense jungle like, so you have to make a plan on how are we going to get through this forest together and get to the other side. So he says, he's done this in an audience setting. So he asks the audience, so what do you need for your team? And people are like, oh, machetes. They're like, yeah, you need machetes because we're going to have to be cutting through to get through this dense forest. And people are like, hey, we need a compass so we know that we're going in the right direction. He's like, oh, yep. So we're going to get some compasses. We might need some tents and some sleeping gear because we don't know how long it's going to take us. So we might need to make sure that we have sleeping gear. And people are like, oh, we'll need a backpack with some, hydration, and we'll, make sure we're hydrated so that we can finish the journey. And everybody does this. And he goes, my goodness, this is a great group of leaders. You guys can get through a forest. Now, nobody asked the question, are we even in the right forest? And I love that story, just for multiple reasons, because it simplifies an important concept, that concept of, as a leader, you have to, the concept of the dance floor. As a leader, you have to be able to be on the dance floor, doing the step, doing the whatever. But you also need time to go step on the balcony and see what's going on the dance floor so that you know how to correct it. Do we have enough people? Do we have enough drinks? Do we have enough music? And something that I integrate with those two stories with leaders that I've had is, I ask them intentionally in their one-to-ones, what are you spending your most time on? And that question is geared to, are you taking time to be on the balcony to see what's going on? And sometimes being on the balcony is just developing yourself, reading a book, going to watch a play, doing something that takes you out, clears your mind so that you can come back and see what's happening on the dance floor and be able to influence it. So those are two stories that I love, that I thought of, that can really make leaders pause and ask themselves, are we even in the right forest? Are we reading? Are we are we leading in the right place?
What about
Mhm.
data?
Oh, yes. Oh, Laura. So, data, every organization, no matter the sector, and we know this from the Baldrige world, is we are results driven. It doesn't matter what you do, at the end of the day, you want to be able to show the results and show the impact. And to be a good operational leader, you want to be able to have good numbers that show you, how am I doing today, that impacts what the outcome is going to be, that lag metric is going to be tomorrow. But data does not come easily to every person. Like, so, maybe if you were I know you're in banking, so sometimes maybe people in banking, I picture them, a lot of it, everybody having, that strong data background. But in most sectors, we have great leaders who don't have that strong data background. So this year I was asked to teach a class, and I really loved it. It was just, one of our facilities they have a leadership development institute that they do annually with their strategic planning. And the president and the strategic leader for that facility said, we want our every one of our leaders, and some of them are like, people who grew up just as frontline nurses and are now have grown into leadership, to be able to tell their data story. And I went and I thought about it, and I said, how do you make data into a story? Because I know I really believe in the power of story. And I landed on the best data story that we know. Let's see. you know so yeah, so and we in that we had a session, I had a workshop where, for the audience, let's see is a methodology of looking at data, where you look at the levels, how are you doing now, the trends, how have you been doing, the comparisons, how do you benchmark, how are you comparing to other people, and then your integration, how is this important, and it was the group of, like, no, probably it was a large group. I want to say more than 50 leaders. And we talked through Let's See. And we said, now, for your most important metric, tell me that as a story. Tell me that, let's see, tell me your data as a story. And that's, I think we talked about it with customers, and we're landing in the same place with data. Is at the end of the day, you're trying to systemize the storytelling process so that it can be done by everybody, and it can be done simply, right? And so we have complicated metrics in healthcare. So we have things like, for everything we say, what's your O to E, observed over expected, and then it turns into a number that's, one or above, and then we rank it. And there's, if you're living in it, you can talk that story, but if you're not, it's just, what do you want me to do? So sometimes just simplifying things to say, we can tell a nurse leader, listen, we don't want you to get any infections. We don't want anybody to get an infection while they're here. We can all agree that's wrong. Being able to bring any form of data in a simple way that people can understand and relate to becomes the most important thing for leaders. Because at the end of the day, some of those things that are important in the background don't necessarily need to be important at the upfront. It's, what am I chasing? Why am I chasing it? Why is it important for me to chase it? And how can I make everybody on my team understand why this is important?
That's right. And LETCI, just for those that don't know what LETCI stands for, it stands for Levels, Trends, Comparisons, and Integration.
Hmm. And it's the best data story ever told, because to me, if I go to a presentation and somebody's just presenting data, 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 to me, I'm like, what's the story here? Why, you can tell me that one group of people, like, we see this sometimes with patient experience. Oh my goodness, they're doing so well. Their patient experience is 85, 85 or 90%. But if the industry is, they compare who they're being compared to, everybody else is at 99. Are they doing well? Yeah. So to me, it's like, how are you doing now and why? How have you been doing? So maybe that 85 is a great thing because, in the last 3 months, you've come from 60. So that's a good story, right? How do you compare where you're trying to go if everybody else is at 70, but you're at 85? Well, I guess that's a good story. Or if everybody's at 99, is it a good story, right? And then why is this important? Why are we chasing this metric? Because sometimes we chase all numbers without saying, which are we in the right forest? Back to, are we in the right forest? Why is this important, and do we need to be chasing this?
Exactly. So tell me more about this legacy leadership.
I love legacy leadership, and you know what? If you went in and Googled, and I did that earlier. Just Google legacy leadership. Everything in the world comes up. There's books on, leading with your legacy in mind, name and beyond, the legacy leader, a leader's legacy, your lead. There's tons of things that have been written about legacy leadership. But talking about story, I think I love Broadway plays. I love musicals, and one of my favorites, Hamilton, the most recent version, the Manuel Miranda version, right? And within Hamilton, there's this time when George Washington, president, is talking to, and he's the experienced, person in the scene, and he's talking to these young men. Hamilton is among them, who have just been dying to get to war. They're dying to, prove themselves in battle. And his exact words are, I was younger than you are now when I was given my first command. I led my men straight into a massacre, and I witnessed their deaths firsthand. I made every mistake, and even now I feel the shame rise in me. And even now, when I lie awake, I know history has its eyes on me. And I love that, because I think it talks about, when you start with the end in mind, you say, if you think of, where do I want to be? What does my end going to look like? It tempers you. Now, the interesting about being tempered is, in my experience, personally, my temperance came with being more seasoned, experiencing life more. It makes you more empathetic to understand. So that when he says, I led my men straight into a massacre. Think about the things that you did as a young leader, or when maybe you were older and you had a younger leader, or you just had a person who was new to leadership, no matter how their age. and you can tell that you were like a first child with them. You know how your first child is the one you experience, you experiment everything, and the impact that that might have on people. Sometimes you have a leader who's just making every mistake because they're getting through that. With time, you can say, you can look back and have the perspective of, gosh, I'd never do that again. If I wanted a team to do something, it used to be important to me as a young leader what we accomplished in the moment, that our results were good and then we were seen as the best. But now when I have a team, I just want to have a lasting impact on them, and for them to say, to think of, to look on this as the experience that elevated them, that opened them up to something else. Or I care more about where everybody's going. How are your children? Are you spending time with them? More than I care about what are we going to produce tomorrow when I'm with them. And I find that we actually produce more when I care about the things that have tempered me. So I do think every leader has to be able to have their story, their where is my end in mind, and then walk backwards. If you're thinking about your legacy, you're going to think into what am I leaving with people, right? And if you lead from that perspective, I think it's a different kind of leadership than if you're just leading in the moment without the end in mind. And when I'm talking about the end, I really mean your legacy as a leader and how you touch people.
That's a very profound thought. When I think back to the dancing, I forget what you called it, the dance floor philosophy or something like
Yes.
that, right?
Mhm.
The leader needs to be on the dance floor doing the steps, like you said, but the real value of leadership is the vision from the balcony,
Yes.
just like you were saying.
Yes. Hmm.
That's what differentiates a manager, perhaps,
Hmm.
who's managing the steps on the dance floor
Right. Hmm.
from the leader, because the leader sees all and
Exactly.
how all the relationships are working and where the communications may need to be focused
Absolutely.
in order to orchestrate and choreograph
Right.
and ensure that all needs
And to see, do we have enough partners? Do we have enough people dancing? Absolutely. Yes.
right. And you know what
Right.
that brings to in mind to me is
Mhm.
the whole concept of servant leadership. That's where servant leadership comes in. Because if you see from that balcony that this group over here is just not getting it, they're not in the step that's needed,
Mhm.
and the organization would be more effective, then the leader needs to take it on themselves. It's not that person on the dance floor who's not in step. It's the leader who needs to take the accountability
Right.
to ensure the communication and the choreography is working.
Right, right, right.
Hmm.
Absolutely right. Oh,
I
Laura,
love that.
I couldn't have said that. You said it better than I could have. You told the story better.
Oh, well, thank you, Victoria. That's awesome. No, but it's because of you that I've now seen this picture and this vision. And now I understand why you chose that quote about George Washington.
Mhm.
He actually learned, and the fallacy of a leader, the mistakes the leader make or can make are not learning from
Right,
previous history.
right,
That's what you bring with you up on top of the balcony as
right.
you're looking at the dance floor.
And I also think that something that's important with legacy leadership is I think it works when you have balanced teams, right? So and we talk about diversity, equity, and inclusion in our organization. We talk about diversity, equity, inclusion, and belonging at DEIB. And if you have a balanced team, a diverse team, you're going to have that person, that those leaders who have that perspective of, I've dragged my team and watched them being massacred and witnessed their deaths. And I was part of it and I led them. And then you're going to have those people who are like, oh my goodness, let's go to war. And if you're lead in on a team like that and you're following leaders like that, it's not balanced. On a leadership team, you also want that George Washington character who's like, hey, listen, I've made every mistake. I've drugged people through this, and they didn't come out, and it's not a good feeling for us, the leaders, when we do this. But you do also need that energy. There's something in that energy of that unseasoned leader who doesn't see anything wrong with anything, all the barriers that can tell you a little story. one of my good friends who's a business person once told my friends and I that you all could never run a business because you think about too much. You think too much. He said, if I heard that they're selling eggs in for $1 each in Florida, I would load my truck with 300,000 eggs, and I'd go to Florida and make $300,000. You all are here thinking about, okay, what's the risk? Can we cross eggs on straight lines? Can we? What you all think too much. He said, by the time you guys decide a plan and have looked at the risks and done all that, I am in Tallahassee selling eggs. So you do need that balance because you want those people, those leaders on a leadership team that say, let's go, let's go, let's go, tempered with the people who say that, listen, we're gonna get pulled over and all these eggs are gonna get confiscated because we haven't thought about A, B, or C, right? So I do think that when you think about D, E, and I in our organization, it's diversity, equity, inclusion, and we add B, belonging, D, and I, B. You want to balance your teams so that you can have those perspectives that make you lead people. I think that's what actually makes a good team. You have that benefit of that George Washington perspective, and then you have the benefit of the gung-ho young leader who just wants to go, and then you have the understanding of the people that want to be followed, because sometimes when you talk about generational leadership, which is a whole other topic for another day, sometimes these people want to follow the gung-ho people, so you want to have that balance, and I think that that's important in balancing or in legacy leadership when you think about how to balance teams.
Right. I love that. And I'd love to have you back, Victoria, to talk about generational leadership. I know you're very involved in that aspect as well. Well, thanks so much for spending time with us. I really appreciated it. Learned a lot. Enjoyed the conversation.
Thank you, Laura. It's always great to talk to you.
Yes, you as well, Victoria.
Thank you for having me again.
Thank you for listening to today's episode of Sterling Visionary Voices, Insights for Role Model Leadership from the Sterling Council. Discover more and connect with us at sterlingvisionaryvoices.com.